Good evening, all. I am Dr. Pragnesh Vachirajani, founder of HitCon. On behalf of Team HitCon, I am welcome you all on this inaugural run or inaugural session of HitCon Hit Talk. HitCon Hit Talk is basically a series of webinars, and the idea is to empower the healthcare professionals with the use of technology and make them aware about the wonderful things that is happening around all of us that are useful to us to use in practice, as well as very important to know the things that is happening around. So we are starting this series of webinars, and we'll be inviting faculties across the globe. As you all know, today's our first speaker is from USA. Sir is from USA. So we'll be having expert faculties across the globe, and we will be delivering talk on the various subject which is pertaining to various specialities, and some will be general topics. The plan is to keep it as on every fourth Friday of the month. So please block your date. And today we are launching it on again a new platform, that is Health Plexus. So just be there on the platform. So whenever a new program is updated, you can very well watch that program in future. So without much ado, I will request Dr. Gopal, who is the main key person behind the instrumental person behind this organizing this program. I will request Dr. Gopal Parikh to take over and take things forward. Dr. Gopal, please.
Thank you, sir. Hello, good evening. I would like to introduce our moderator of the session, Dr. Gurudat Gupta, is the head of histopathology, Rajiv Gandhi Cancer Institute and Research Center.
Can we have the slide, please?
Yeah, he is a co-investigator in the image biobank of the cancer project, and the developer is currently working on the TIL score in the colorectal carcinoma using CD3 and CD8 using the software QPath. And other than digital patho, sir is expert. His area of interest is uropathology, breast pathology, and GI pathology. The second, our moderator of this today's session is Dr. Rajiv Kausal, sir. He is a professor in oncopathology, Tata Memorial Hospital, Mumbai. And sir is a board of director, Asian Society of Digital Pathology, and he has more than 150 publications in national and international journals. And along with the digital patho, sir has other key interest in the thoracic, GI pathology, and molecular pathology. Over to Gurudat, sir.
Good evening, everyone. Thank you, Dr. Gopal, for introduction. And I thank the organizers at onset for inviting me for this wonderful webinar with Dr. Singh. And we all know that the AI applications in healthcare is widespread and commonplace than what we realize. And with digitization of patient data, it has revolutionized the management. And now we can actually digitize the unstructured data. So that is a very exciting field. Now, the AI is used in oncology commonly for example, radiation planning, radio diagnosis. There are so many approved, FDA-approved softwares, and for surgery like 3D modeling. And, however, in lab diagnostics also, if you realize, it is very commonly used, especially in automated analyzers, which are used for biochemistry, molecular pathology, bioinformatics, pipelines, and automated sign-outs, which are all algo-driven. So we are using actually AI. However, histopathology is somewhat lagging, and it is now slowly adopting digital pathology by now we need digitization of slides, and the same can be used for AI applications. However, this adoption has a lot of challenges and requires digital transformation of the histopathology laboratory per se with implementation of digital workflow. So in this webinar, our esteemed speaker, Dr. Rajendra Singh, will enlighten us about the various aspects of digital pathology and AI application. Now, over to Dr. Rajiv for introducing the speaker. Thank you.
Thank you, Dr. Gurudat. And it's our honor to welcome Dr. Rajendra Singh. And he is the man known by PathPresenter because he opened the channel of digital pathology for education for all And his contribution, the PathPresenter platform, it is so common and so popular that there are more than 50,000 users across 180 countries. And this tool, this platform is now not only restricted for the educational tools, but also used by many residents, trainees to get familiarized with the digital pathology. And in future also their team is planning to incorporate this into the clinical workflow. And so that is another important thing which PathPresenter is moving, because this platform is developed by the pathologist. So he is well aware of our needs and how the technology can best suit to our routine workflow. So that is the beauty of this platform. So in addition to the PathPresenter, there is a lot of things to be talked about Dr. Rajendra. He's right now he's working as a director of the dermatopathology and digital pathology at Summit Hospital Healthcare in New Jersey. And he was a recipient of the Best Teacher of Year Award in Mount Sinai for consecutive 5 years. In addition, he was also nominated for the pathologist power list, top 100 pathologists for 4 years. That is a very remarkable contribution, like for year 2020, 21, 22, and 24. I don't know why he missed on 1 year. In addition, he was also awarded by the CAP, College of American Pathologists, for his lifetime achievement award in year 2022. So there are long list, as I mentioned, for his immense academic contributions. He's part of WHO books and written many books and other things. So we can it will take more than 15 minutes to talk about his achievements, but I will like to invite him to start the session and deliver his talk on the topic, the evolution of AI in healthcare, with focus on digital pathology. And I am sure that our attendees will be very happy to hear about the perspective and the evolving concept of digital pathology and AI and the clinical practice. Over to you, Dr. Rajendra.
Yeah, thank you, Raji, for the kind introduction, and thank you for the organizers to invite me to give this talk. It's a privilege to start this conference off as being the first speaker, and we'll try to cover as much as possible, because 45 minutes or 30 to 45 minutes is not a very long time to cover everything that is happening in the world of pathology. And also try to relate it to healthcare, because we know that the audience is a diverse audience. It's not only pathology audience. So we'll try our best to make sure that we can cover as much as possible as relevant to healthcare. I'm going to share my screen.
Yes, sir.
Yep. So the topic today, evolution of AI in healthcare and as related to digital pathology. And as a disclosure, as already mentioned, I'm a founder of the company called PathPresenter, but we are not going to talk about PathPresenter today. So as you must have all realized now, pathology is actually transitioning from what was traditionally using a microscope for the last 100 to 150 years to now these slides being digitized and being visible on the computer. So what we call as digital pathology. But one thing that we all pathologists are trying to see, can we take the word digital out? Because when you look at radiology images on the computer, you don't call it digital radiology, which is different from radiology. You just say radiology. So hopefully the time will come when we don't have this specific term called digital pathology, digital pathology and pathology will become the same. And just to give you an exposure to what the digital pathology slide looks like, if you have your phone right now, and if you can take your camera out from your phone and you can scan this QR code with your phone, you will be able to actually see a link that will open up a digital slide. So you can just try it out right now. Take your phones out, open the camera, and then scan this QR code. And when you look at that image, you can actually use your 2 fingers then to zoom in, rotate, and everything that you would do for an image on a microscope. So you can zoom in, you can rotate the image, you can look at high power, you can look at low power, and that should give you the power of this technology. Like, right, it converts that digital slide into a 3D image that can be now visualized on the phone. So you can see now when you have this kind of an image, there's a lot of efficiencies that can come to pathology. So like I can be presenting at a conference, but I don't have to I can still sign out my case now remotely. I'm not chained to the microscope. Previously, a pathologist was almost chained to the microscope, so now that is gone. I can easily show my cases to anybody around the world. So if I have a difficult case and I want to show it to Rajiv, I want to show it to Dr. Gopal Bhai or Dr. Gupta, it's very easy for me to just like I shared the link with you right now. I could just immediately put the link into an email or a message and send it to them and say like, what do you think? So it makes it very, very easy for me to show the case to them. For pathologists, they're always trying to pull out previous cases. Like if I get a re-excision of a melanoma or a re-excision of a lung cancer, I want to look at the previous. And as a pathologist, we know sometimes we have to wait for days for somebody to go into the attic and then pull those slides out. But now with a digital slide, it is much, much easier. There are a lot of augmentative tools now to make the work more efficiently, which we will talk about in the next few slides. Obviously, a new world of research opens up because now you have a digital image, and all the technologies that Facebook or Amazon or Google has built related to facial technologies, images can now be applied to these digital images. And obviously, like it's a much better communication with clinicians because I could actually share a slide with the clinician and then talk about the features on the slide of why this is diagnosis X and why this is not diagnosis Y. So the communication is much, much better when you're talking to the clinicians. When we start using digital pathology, like we don't have to send glass slides around for a pathologist to see them because many times a hospital has one central lab and they have pathologists sitting all over the city or even all across the country. And they have to ship the slides basically. So all that is now gone. It is very easy to now just upload the file onto the internet and like immediately make it available for any pathologist to see. So if a hospital has a neuropathologist sitting in one place, they don't have to worry about how will I send all my neuro cases to that neuropathologist. It's very easy to like just upload them and then make them available to the neuropathologist. And then sometimes you can get into legal trouble if you lose a very important slide because the slide got broken or something. So all that legal implications are gone. And this is very important in the US because we know that one of the major hospitals in New York actually decided to go digital pathology the next day when they were hit with a $5 million legal issue because of losing of some very important slides of a case. And then it's not only for the pathologist, like it is also giving more power to the clinician oncologist because now the clinician, when they are discussing the case with the patient, they can actually open up the slide and talk about the case. People will normally go to Google and they will look at Dr. Google and get all the wrong information. Here now it's much easier for the clinician to actually talk to the patient and talk about the diagnosis. And when there is a very difficult diagnosis, when the patient has cancer, they are very interested in knowing about the cancer. They will go to all kinds of resources to like see like how the diagnosis was made, what kind of diagnosis do I have. So this makes it much easier for them to talk to the clinician and the oncologist. When we are doing like consensus meetings, we are doing tumor boards, or we are talking to other clinicians, it is much easier now to share those cases. For a person who's doing surgery and they are doing the frozen sections, they might want a pathologist to be available for a frozen section. Now the pathologist doesn't have to sit in that room where the surgeon is because I could be sitting here in the US and still provide a frozen section diagnosis for a surgeon practicing in Ahmedabad. So it's very easy for the surgeon now to like get a second opinion or a frozen section diagnosis very quickly. And then obviously like a lot of work is now being done for AI tools that not only help a pathologist making a diagnosis, but there are AI tools that can help by looking at the digital slide, decide the prognosis for the patient, decide the treatment for the patient. All that can now be done from a digital slide. So there's a lot of AI tools that are coming up that adds a lot of power to the clinician and the oncologist. And then obviously now everybody talks about big data. So if you look at all the AI companies, if you look at even the major technological companies, they are all talking about big data. And when we talk about medical data, like we know radiology is already digital. We have all the patient's data in the EMR, so all that data is already digital. So now we have the pathology data that is also becoming digital. So it makes the case for a spectacular data repository that has all the information about the patient, the clinical history, the radiology images, the pathology images, the treatment history, everything is there. So all that can now be brought into a central data bank, shared with other institutions, and they can be used by researchers, AI developers, pharma companies for clinical trials. So it makes a very big use case for now why people want to use digital pathology. And obviously, we know that the most important use case for digital pathology is when we can start using AI. Like, can it help me make a better diagnosis? Can it help me make a faster diagnosis? And going beyond the pathologist, can it help the clinician decide the prognosis for the patient? Can it help decide the clinician the treatment for the patient? And it is all true right now. It is all happening right now. It's not only like we're talking about it, it is happening right now. There are AI tools that can actually prognosticate the treatment for a prostate cancer. They can prognosticate the treatment for a lung cancer. So it's not only helping the pathologist, it is also helping the clinician and obviously helping the patient find the right treatment and getting the right kind of information about the disease. And like for AI in pathology, I could do a half a day talk about all the different AI tools that are now currently available. But just to give you a very, very simple overview, like the current AI tools that are already existing and available for me to use today. Like there are tools that can help me detect a tumor within a lymph node. There are tools that can help me classify a tumor. Like, like when you get a tumor of an unknown origin, like many times you have to do a lot of immunohistochemical stains to decide where the tumor is coming from. And even after throwing 20, 50 different stains, we sometimes are not able to come to a conclusion that where the primary is. But now there are AI modules that can actually look at a digital slide and help you classify say where the primary might be basically. So rather than doing 20 stains, 50 stains, you can just use 2 or 3 stains to confirm the diagnosis. There are AI modules that can help localize very microscopic features, when the tumor is very small or microscopic, whether it's in a lymph node or whether it is in a tissue, now they can actually help you localize the tumor. And if you think like many people will say like, what if the AI is wrong basically? Like who is this for? But let's say if the AI is right 80% of the time or 85% of the time, at least in those 80 to 85% of those cases, now you can immediately localize the tumor. So you don't have to waste half an hour looking at that slide or that lymph node finding that tumor. If you look at the localized tumor and you think that the AI is wrong, it's okay. You can say that the AI was wrong, and because in the final, it's it's the pathologist who's making the diagnosis. But in at least 80 to 85% of cases, your time has gone from 30 minutes to 2 minutes, where you don't have to spend 30 minutes trying to find that microscopic feature like a location of the tumor. So you have to think of AI as an augmenting tool to you. It is not like a diagnostic tool to you. It is only helping you do your job in a much better way. And that is how, if you think of AI in that manner, it is going to be a very, very useful tool to use in your daily practice. You can talk to a pathologist, like they sometimes waste 30 to 45 minutes looking at a special stain to find that one microorganism that will help them make the diagnosis of tuberculosis, that can make the diagnosis of leprosy. And now there are many tools that can actually immediately point that this is the most likely organism. Again, if it is 80 to 85% right, it is very helpful, because for the rest of the 15% of the cases where it was wrong, I can say this is not an organism. So let's not use this one as a positive case. We can still look around, put my 30 minutes into that case, and if I don't find the organism, I can say negative. But for the 80% of the cases, my time has gone down from 30 to 2 minutes. There are AI tools that can now help prognosticate a lot of tumors, lung cancer, prostate cancer, where you can actually say whether the patient will develop a metastasis, or whether the patient will live after 5 years. There's a lot of tools that are now being built where this can be predicted from a digital slide, from an H&E digital slide. And then there are a lot of now AI models that can also predict the underlying molecular alteration. Does this melanoma have a BRAF mutation? So that the patient can be given a drug that is targeted towards the BRAF mutation. Does this lung cancer have a KRAS mutation, or does this breast cancer has a low HER2/neu? And all that can now be predicted from H&E slides by AI modules. So it will help then decide the treatment for the patient, because there are so many different companion diagnostic drugs that are now becoming available that are focused on targeted mutations, that are focused on targeted molecular changes. So now if you want to use that drug, you need to know whether that patient has that underlying molecular changes or those genetic changes, and they can now be predicted by an AI module. So you don't actually have to do the testing, you don't have to do all of that. It can be predicted by the AI module, so then you know that this patient can be given this kind of a companion diagnostic drug. And then the big thing that has happened now is this large language and the generative AI modules, which has like exploded into the world in the last couple of years. Like we hear these terms almost on a daily basis, not even on a daily basis, on an hourly basis now, basically, where you hear somebody talking about generative AI, somebody talking about ChatGPT and Gemini and Anthropic and Sonnet and Chat, everything under the sun. People keep talking about this all the time. My kids who are in school and college now use ChatGPT all the time for all their queries. The younger generation is too much into like using ChatGPT for everything that they would like to, doing mathematics, doing physics, doing geometry, everything is now being used. ChatGPT is being used. So this generative AI applications are being used a lot in healthcare, not only in pathology, a lot in healthcare basically. And as a pathologist, as a person who's working also in academics, I use it all the time to write now reference letters. Like somebody says, like, can you write a letter for me? I just take that CV, put it into ChatGPT, and it produces a letter that I would have taken like almost 6 hours to produce. Like the quality of the letter is so good that I only have to do a little bit of modification, then I can then create that letter in 2 minutes basically. AI is being used for writing and analyzing code right now, and for writing emails, for scheduling management, and all the different things that generative AI applications are now coming across along our way. So as a clinician or as a pathologist, now you are worried, like, how do I keep up with all this? Like this, there was already this artificial intelligence that people were talking about that I didn't get to use much, but now all this generative AI modules have come up, and you are just like a little bit confused about, should I really get into this? Should I start learning about this or not, basically? But like, I think it's very important for all the clinicians on this call to understand that if you want to remain relevant in the next couple of years, you have to invest yourself in this education. There's nothing better you can do actually, because the world is moving at a very rapid pace. These tools are now going to be available for clinicians to use. And it is not that they will replace clinicians. The tools are never going to replace clinicians. The AI is never going to replace a clinician. But a clinician that is using the generative AI, or a clinician that is going to use AI, will definitely replace the clinician who is not using the generative AI, or who is not using all the different kind of AI modules. So it's not the AI that will replace the clinician. It is the clinician that is using the AI will replace the clinician who is not using the AI, basically. So you have to understand, so you have to invest in yourself, try to educate yourself, and there is so much material available online that you can easily like start learning about this. How are these tools affecting my practice? How are they in my specialty? How are these coming up along, and how can I use them? It's very, very important for all the people on this call to like understand that if you really want to remain relevant in the next couple of years, you will have to like start educating yourself. So it's understand, and if you don't understand this basic concepts, you are going to be in a big disadvantage, because they are very transformative technologies, and they have the potential to completely change the practice of healthcare. And if you know how these technologies work, then you can do some kind of a responsible integration of these technologies into your work, rather than a Google coming along, or Amazon coming along, or somebody else coming along and saying, this is now already integrated into your workflow, you are going to use it. So it is better for you to see these technologies, understand these technologies, and integrate them in a much more positive manner, rather than in the long term being forced, like this is a technology that has already been integrated and you have to use it now. Because once you start understanding these technologies, then you will also appreciate the limitations of these technologies. You will be aware of the risk of these technologies, so that you are not just sitting on the side and like thinking, what will I do now, basically. You have to equip yourself with all this technology so that you are ready when this happens in your field, basically. And when you talk about artificial intelligence, like people are now getting very excited about it, but it is not something that is very new, basically. Artificial intelligence first came up in the 1950s. So it is almost now 70 to 80 years when people have been talking about artificial intelligence. And there is a lot that has happened in the last 70 to 80 years to where we are today. So in the last century, it was all about foundation models, which were like it was all about the classic machine learning. And the classic machine learning is rule based. Like it was more you do like your hand engineered annotations that this is the tumor area. So then you have like 500 cases where you mark the tumor area, and then you give those 500 cases to somebody, to a machine, and they will then learn from that annotation that you have done on that. So this was more of a rule-based AI modules that were being created before that. Then came the deep learning, where the machine started like learning from the data itself without the annotation, without you giving it the information. But the field has now exploded in the recent years with the generative AI, where things have completely changed. And this actually started off more in a much more rapid way into 2017, where through this paper came out from Google, that is attention is all you need, where they introduced these transformer models. The transformer models are different from the CNN models that were before 2017. So I have all the different AI models that I showed you about the localization, about detection. They were all based on CNN convolution neural networks. But now with the transformer technology, things are very different. These can be scaled massively, so you can now train on large data sets. And the big difference is they do parallel processing. So it's not like one after the other. Like you're not feeding one image after the other. You can now feed a ton of information into these transformers, and the output is much better and much faster. And when it comes to the fields of like pathology, radiology, dermatology, which are more visual, where you are looking at the patient or where you're looking at the image and making up a diagnosis, this was the paper that changed that completely, where now instead of just the text, you can actually input the images, and then the transformer models would take those images and then do the prediction. And this paper came out again from Google in 2021, an image is worth 16 by 16 words, where these transformers were now using images instead of the text. Previously, you take the text, you break it down into multiple tokens, and the tokens were then fed into the transformer models. And now what is happening is you take an image, you break the image into multiple patches. So the patches are equivalent to the words of a sentence. And those patches are then fed into the transformer model, and then the transformer model starts learning from those patches, and then they build those predictive models from those patches. But this is completely changing the field of pathology, completely changing the field of radiology. It is also affecting dermatology in a very big way. It is affecting ophthalmology in a very big way, because these are very visual fields where you are looking at images, or you are looking at and then making a diagnosis, where you don't even touch the patient. You're always like just doing visualization of the lesion, or visualization of the image, and then you are making a diagnosis. So like if you start going back a little bit, like if you want to educate yourself, like there is this whole big field of generative AI. So what is generative AI? As the word term suggests, generative AI means create generative. So it is generating something new, basically. So it's creating new data. It could be textual data. It could be image data. Now there are video that are being generated. There are speech that is being generated, code that is being generated. So all of that falls under the umbrella of generative AI. Then under that come the foundation models which have been built, like the initial ChatGPT model was a foundation model, out of which then you had ChatGPT 4.0, 5.0. So they kept building on that. But the initial model was a foundation model that was trained on a huge amount of unlabeled data using this transformer technology. And then they were fine-tuned for a fight. So now what they're doing, they're fine-tuning these foundation models to make them better and better, basically. The large language models, as the name suggests, it is based on language. So they are based on text data. So they use a lot of textual data to train this. And then once it has been trained, then it is used to write different kinds of creative content and answer questions. Then came the vision models, where now they were being trained on a large amount of image data. And this was now, there were models being created for image classification, for identification, localization objects within the images, and new image generation. And now the most important thing that has come up is this multimodal models. So the multimodal model will take the textual data, will take the image data, will take all different kinds of data like video data, and then they will be trained on that kind of data, and from there they will be used to predict something new things basically. And that is very relevant in healthcare, because as a clinician, you are never making the diagnosis in a vacuum. You're looking at the clinical data. You're looking at the radiology report. You're looking at the pathology report. You're looking at the molecular changes. You're looking at the molecular alterations. So you're getting input from a lot of different models, or you can call it like models at this point. And then using that, you are like, all that information in your brain, and then you try to come up with a very specific diagnosis. So these multimodal models also are working in the same way as the clinician's mind is working. So they're looking at the textual data, they're looking at the radiology images, they're looking at the pathology images, they're looking at all the other prior history of the patient, everything that was given to the patient. And then based on that, they're helping you build new technology that can help you diagnose better, that can help you do prognosis, that can help you predict treatment, and all that is now coming along your way. And there's a lot of different applications that are already being applied in pathology. I'm not going to go into all of the details, but like creating summaries, you've already seen that happening in the healthcare space, where there are models being created by Microsoft and companies like Nuance that can take all that summary of the patient's information in the EMR and then create a summary for you. So you don't have to waste your time going through the entire patient's history. It will actually create a very relevant summary for you. Those are actually tools that are now available in the market. It's not like these are only in the research space. They are not, these tools that are available in the market. There's a lot of different pathology modules that we will talk about that are vision models right now coming, and obviously the models that are coming right now. In pathology, we have started seeing a lot of chatbots being created that can now be actually integrated within the viewer itself. So when I'm looking at a slide and I have a question about the slide, I can click on that chatbot, and then it will actually produce some kind of a result. So if I have a question like what are the difference between the ICC and the WHO criteria for myeloid neoplasms, it will actually give me all the information, because at that time I'm looking at a myeloid neoplasm. But it not only gives me that information, it also gives me the source of the information. So I can actually click on that source and then go back and look at the source. So it's not like a hallucinated information. It is information that is actually coming from a source. And you can look at the source and decide like whether the information is right or wrong, basically. So this is now available technology. It is not like just paper. This is available technology that we have in front of us right now. And the vision, this is not available technology, but the vision for a pathologist is now that they will, when they come in the morning, they will have all the slides as digital. Not only the slides, they will have a suggested diagnosis by the vision transfer model. It will give them all the suggested diagnosis. It will give them the important features on the slide. It will tell them what IHCs they can use to like make the final diagnosis. And obviously there's the chatbot available to answer any kinds of questions. And when you click on any of these features, it will actually also point out the features to you. So a lot of different work is being done in this space where this is coming in the future. There is like, you might say like this is not possible, but it is really coming where the AI will be able to predict at least the differential diagnosis for you, so that you can look at the differential diagnosis and decide what the diagnosis is. So, and then like, just to give you like the power of this technology, like how is this technology right now evolving, and like where is this moving towards? There's so much new stuff that is coming right now. Like if you look at, you have seen all these fake images, like you see this fake images of Bollywood heroes and heroines that are not the true images of these patients or of these people. So there is a lot of technology that allows like to generate, like the word is generate new images from what is available on the internet. But this new images, what the fake images is what is now called as synthetic data. So this is all synthetic data because it is being synthesized by the AI modules. So what is synthetic data? It is new data that is being created, but it looks very similar to the real data. But when you want to what is the importance of this when it comes to healthcare, when it comes to pathology, when it comes to radiology, when it comes to any kind of specialty? It could be dermatology, it could be neurology, any kind of technology. So if you can have a lot of patient data that is very mimicking to the old data, to the real data, then you can actually use that data to train and test machine learning models. Especially because real data is not easy to obtain, especially in the US. If I need a lot of data for a patient, there's a lot of loopholes that I have to cross. I have to go through IRBs, I have to go through multiple different institutions and organizations to get access to a large amount of data. So rather than waiting for that data, I could actually start using synthetic data. So I'll still need the real data, but I don't have to wait for months and months to get my real data. I could go ahead and use the synthetic data and then not wait for the IRB approvals or to talk to multiple legal authorities to get my data. So this is a very important use case that is coming from this fake videos that you're seeing, that the fake data. But when it comes to healthcare, the synthetic data is becoming very, very useful. And it is very good. These are papers that we have seen. Look at this is the synthetic images and this is the real images. They look very, very similar. When people are using them for testing or training of algorithms, they work in a very nice way, basically. So you can have clinical images, you can have radiology images, you can have pathology images, and they do a pretty spectacular job about producing this kind of synthetic data. And based on this is the Gartner chart. And Gartner is a US company that does predictions for the future. So what is going to happen in technology in the future? What is going to happen in healthcare in the future? And what they have said is by 2030, synthetic data will completely overshadow real data in AI models. So right now, the real data is being used more, and all the AI that is being built today is using more of real data than synthetic data. But as we move along, the synthetic data is going to overtake the use of real data. And we'll see a lot of AI models being created by synthetic data. Another very fascinating aspect that is happening right now in pathology is 3D pathology. So right now, when you look at the tissue, when you look at a glass slide that you look under the microscope, it has been cut from a tissue that has been preserved in a block. So when you send a biopsy to the lab, they will cut the biopsy into small pieces, put those pieces into a block, and then section those blocks to produce the tissue that will be seen under a microscope. So now there are technology that can actually completely do a visualization of the entire block, basically. So you are not even cutting the tissue. You just put the block under the machine, and it will actually produce an image of the entire block. So you're rather than looking at thousands of levels, cutting thousands of levels, this will allow you to see the entire thousands of levels in this technology, basically. So I don't even have to cut the tissue. I can look at the entire block through this technology. So this is called 3D pathology. And it is very useful in a condition like Hirschsprung disease, where you normally have to look at 70 to 100 slides to find that one ganglion, to say whether the patient has Hirschsprung disease or not. But right now the entire block can be visualized by a 3D machine, and it can easily tell you through AI modules whether there is any ganglion within this or whether there is no ganglion within this. So rather than wasting almost 2 to 3 hours going through 70 tissue slides, all this technology is now coming in front of us, where the entire block can be visualized using these technologies, and very useful in some of the conditions which pathologists put in a lot of time. But what I'm trying to show you is that there is a lot happening behind the scenes that you might not be aware of, but how these technologies is now moving in a very, very rapid manner. The next technology that might change pathology in a very big way is virtual staining. So by virtual staining, what we mean is normally when I have an H&E image, I many times would want special stains. I want a PAS stain, I need a GMS stain, or I might need immunohistochemistry, I need S100. There are hundreds and hundreds of immunostains that we normally do in our practice. But now with virtual staining, you don't have to wait for 1 day to get your stain back. You can actually just produce an unstained digital slide, and then these technologies now available where you can stain this by just clicking a button. So you can have an H&E slide, and then you can do a transformation to produce a PAS. You can do a transformation to produce a meson trichome or a reticulin stain. So rather than like cutting more tissue, sending it to the lab to like get them stained, you could just use one slide, unstained slide. Say I want an HNE image, one button. You say I want a PA stain, one button. You need a mesotrichum, just one button. And it will like start giving you all those slides in 1 minute. So rather than waiting for a couple of days to make the diagnosis, you can now do the diagnosis in 1 hour because all the stains are now available at your fingertips. So for pathologists or for clinicians, like I always tell them, like either you become part of this technology and lead the way, or there is a time that will come where you will just be asked to get out of the way. So it is very, very important. Like I can keep on talking about all the different kind of AI modules that are coming in front of you, but I was trying to give you just a gist of what is happening in this world right now, because you cannot, you don't want like to see headlines like this, basically how chat GPT and other AI tools will change healthcare. You don't want to see that. This is a real cover of a very big magazine. What you want to see is how doctors using chat GPT and other AI tools will change healthcare. You don't want to see how chat GPT will change healthcare. You want to take control of this. If you really want to do this, you have to like start getting involved into all this. So you can't be Gandhiji's three bandhas, basically, that I'm not going to talk about it, I'm not going to hear about it, I'm not going to listen about it, or put your head in the sand, basically. You have to like take part in this, like how in the evolution of this technology. Yes, like we also have to be aware, again, another Gartner chart, like some technologies, there is a lot of hype and then they completely die down, basically. That happens with every new field in technology that happens. And then they slowly start realizing that everything that was told is not very real. And then there is this trough of disillusionment, and then people start taking all the good features from the hype and then producing the slope of enlightenment. So this is a real technological curve that we have seen for every kind of technology. And we know, like, people talk about these big expectations from AI that, oh, we will have self-driving cars where we will just be sitting in our car and saying, I need to get to the office, and we don't even have to look at what is happening outside. We could still be working in our car. But when it comes to the real world, we know that is not the true case, basically, because we hear about these crashes all the time. Because when they are building these models, they are building these models on parking lots. Like the training for this AI modules is being done on parking lots. And when you are in real life, you're not driving on a parking lot, you're driving on a mountain, you're driving on different kinds of terrain where the reality is very different, basically. So the reality is very different, no doubt about it. But we have to get used to these technologies. And we have to also remember that medicine is very, very different. It is when people talk about AI for a self-driving car, there you can do all kinds of simulation, but in medicine, you cannot do those kinds of simulations. So we have to be aware of the limitations and the advantages of using this technology. So if you can, and you can only be aware of the advantages, the limitations, the risk, if you start getting involved in how these technologies were built, and starting understanding these technologies in a better way. Because it is not the strongest of the species that will survive, not the most friendly, but the one that is most responsive to change. So you have to be responsive to this change, understand these technologies and get used to it. I just gave you a very big overview about what is happening in this space related to pathology and healthcare. But it is for you to now take the bull by its horns and say, I'm going to start learning about it, reading about it, understanding them, and see where I can apply them to my own field, basically. Thank you very much.
Thank you very much. And I think this is the amazing overview. And within 40 to 45 minutes, you have taken us through the whole journey of this field, right from the digitalization to the future AI and the generative AI, the way it is coming. And I must agree with you that we have to adopt this technology to take the best benefit and potential benefits of it. So any comments from Dr. Gurudat, and then we can take up some questions.
Dr. Singh, it was an excellent talk, and you have taken, actually it is quite, you have outlined all the challenges which are there actually very nicely and subtly. So I think we should all concentrate on applying this in our routine practice. Now, the biggest challenge I think is the adoption. So my I mean, I would like to know more about how you have adopted to this technology of AI in, especially when you are practicing dermatopathology. What we have seen, the tools are quite advanced and well used in dermatopathology compared to other faculties.
So right now, like we have an AI module that can actually make like diagnosis for 40 different conditions in dermatopathology. And we are testing that tool out. Actually, I just got the results back today. This is a company that is based out of Germany, and we gave them 150 slides. So they send me the results back. So we are going to like see how the results were, and if the technology is pretty good, we are going to integrate it into the clinical module, so that when I come in the morning, those diagnoses have already been made, the report has been created, and I can then like just see whether the report was right or wrong, basically. So that is one thing that is already in the works right now. Just recently, we also created a chatbot for dermatopathology, where we like took multiple different resources of dermatopathology and then created a chatbot. And right now that is also being tested in 20 different locations across the world, where people are now using it. And the results, like people are telling me that like when we have a difficult case and we put information into the chatbot, it is actually giving us a very good list of differential diagnosis. So we are seeing all this now coming into our field, and in the next couple of months you will see them in the real practice also being used actually. So at the USCAP, we are actually planning to demo a clinical module that has an inbuilt DermPath AI built into it, which will already make the diagnosis, which will put in the entire report, will put in the CPT codes and the ICD codes already put into the system. And for the dermatopathologist to come in the morning and just look at the report and the slide and agree and disagree.
It will be excellent, actually.
So, Dr. Pragnesh, so how do you find this type of solutions coming from the clinician's perspective? So, are you going to bother the pathologist, or are you ready to gear up to adopt this type of generative?
First of all, this looks very exciting, but there is always a concern in the mind that how a common doctor who is not tech savvy or will take these things development that are coming up in a very big way. Because see, I was just thinking during the talk. This is just mind-boggling. This is the way the things are happening and the way things are happening around. This is absolutely, see, I'm basically a clinician, so we always used to see the paper report that we get from a histopathologist or something and then guide our patient. But I think in the future to come, this will also help us to explain our patients in a better way, though we are not an oncophysician or oncologist. Still, we'll have more deep understanding. Otherwise, some difficult jargons to understand all the time. So this will definitely change the thing. So I think a lot of things needs to be done for this. But still, this is really exciting future to come.
So let's take a couple of questions which came to the chat. So Gopal wants to understand the basic requirements to start the digital pathology in a medium-sized hospital, because that is a very big challenge there. Because now some academic centers, especially tertiary care centers, they are adopting, and even the private big corporate labs, they are going and ready to invest. But what are your recommendations for small labs and small centers? How can they cope up with this technology, considering the high cost of high cost? That is the major hurdle.
The main stumbling block that why pathology and digital pathology have not become one thing, because we still talk about digital pathology as a separate thing and pathology as a separate thing, is the cost involved. Like a scanner that can scan like 400 slides costs around $200,000 to $300,000. So that's a huge investment that is not possible by the smaller pathology groups. But now, like what we have seen is the digitization as a service coming up in a bigger way, especially in the US. We have seen that, where you are going to see companies actually setting up scanners in multiple different locations, and you could actually get your slides scanned through that location. So that is like a scanner company. But the other trend that we are also seeing is that like major group, like let's say like Tata Cancer Hospital already has a big scanning center because they have invested in the scanners. So now the other thing that Tata can also provide is digitization. So that is another trend that is happening in the US, where these big centers are now becoming digitization centers, where hospital could either send in the tissue or send in the glass slides, and they are being digitized in those hospitals, major hospitals, and then they are being sent back for the pathologist to see from wherever they want to see. So people are now trying to find ways to like overcome this big initial capital expenditure and go like per slide, per case basis. So eventually, the based on Moore's law, the price of this technology will also come down, and we have already seen that happening, especially with the smaller scanners, not with the bigger scanners, but with the smaller scanners. We have seen the prices now coming down. They were initially 40,000. Now we have seen 20,000, and I think by March you're going to have a scanner that is around $10,000 to $15,000. So the price is also coming down, but digitization as a service either by the scanner companies or by these bigger major hospitals that have invested a ton of money into digital pathology is now coming up as a solution for the smaller labs to go digital. But yes, still it is a big stumbling block for them to go digital because the price per point is still a little bit higher than what they can. And especially in India, when for a biopsy you're only charging like 1,000 to 2,000 rupees, like going digital is a much bigger expenditure that can, it's very difficult to like get any kind of good return of investment for these scanners if you're not going to like be able to like transfer that cost to the patient or to the biopsy charges basically.
Yeah, I completely agree with you on this points, and but the way forward is we have to find out some jugaad, and Indians are very very good in finding some jugaad, and that is the very good thing which you mentioned, that the centers which have this invested in the technology, they should open the door for as a service to others at some subsidized rate, which can give some return on the investment also, and help to sustain this service.
And this is already happening in some of the spatial pathology investigations. The smaller labs collect samples and send it to bigger labs. I think that maybe in future can work like this, that way.
Yeah, like, but in this one, what is happening is they are digitizing it and sending it back to the pathologist to sign the case out. So it is just like charging for the digitization. So it's a win-win situation because the big centers have already put in the money. So they get more revenue because they're digitizing the case. And for the smaller centers, they don't have to digitize put the money for the digitization. They can still do digital pathology.
Right.
So one more thing which is quite challenging in India is about integration or integrating these scanners as well as these new models, AI models, which you talk about a lot. So how what is the way to go for this type of integration, and what is the practical solution you see? Because there are different companies scanners, and there's no single solution, and everyone, they sell their own viewers, and then there's a restrictions of integrating the algorithms into the platform. So what is the way ahead for that?
Yeah, so right now, like when you look at the AI companies, till around 6 months ago, like they had the AI modules on their own servers. You had to send the data to that server, and then they would run the AI module, and then the results would come back. And that was not a very feasible solution because, like, one, you're sending the data outside of the institution. And secondly, when you get the results back, like, do you have to have a separate viewer to see those results? So that was a very difficult complication to overcome. But now, like in working with multiple different AI companies, what we have come up with is like a Dockerization solution. So like what you mean by Dockerization in technologies, you take that AI module and you bring it within the institutional firewalls, but it is still owned by the AI company. So the code cannot be stolen. So that is a solution that many AI companies are becoming more comfortable with right now. So now we are starting to work with like Page and Ibex and getting their models to Dockerize within the DMZ or the infrastructure of the institution, so that the data doesn't have to like move all the way back and forth basically. So that is now at least a feasible solution where the data transfer problem has been resolved. You don't have to send the data outside of the institutional walls. So that has been resolved. Now the other part that we need to resolve is like how do you see the results of the AI, because each result could be different. Some have annotated data, some have heat maps, some have textual data. So that has to be now brought into the viewer. But again, there is a lot of work happening in that space where AI companies have also realized that if they want their AI modules to be used, they will have to work with IMS companies to get the results to be seen in that IMS viewer, which IMS is the management system for the pathology images. So if they can bring those AI results into, so there's a lot of work happening. Yes, it is still the beginning process, but everybody is now realizing if they want to work, they need to work together rather than in silos. So that siloed thing is now going away. They are able to bring the Dockerization, they're able to bring in the results. So hopefully that will all start getting more integrations and more standardization across multiple institutions.
Yeah, I completely agree, and Dr. Gurudutt will also agree to it, because this is, we are seeing the future, and how much time and resources it will take
Yeah.
to adopt,
Resources is a
only
issue.
time will tell. Yeah.
Yeah. And the companies won't be easily willing to Dockerize with, and our IT team also. That is
Yep.
both are issue. There are some other questions also.
Yeah, Dr. Gurudutt, you would like to address?
Okay. Can digital slide scanning replace need for physical storage for accreditation purposes?
Right now, no, because the CAP hasn't changed the rules for the for keeping the slides for 10 years. So right now, the CAP accreditation requires the laboratory to keep the glass slides for 10 years minimum. After that, they can throw away the glass slides. Many people don't. Most institutions like Tata also, I don't think they throw away any slides even after 10 years. But you have to keep the slides for 10 years. And there is no rule for digital data as of yet. So right now, what people normally do is they will digitize the glass slide, and then they will keep it for 2 to 6 months till the diagnosis is made and the patient has been treated. And then they delete the digital slide so that they don't have to like pay for the storage. Because you always have the glass slide, because that is a CAP requirement. So if you need the slide back, you can rescan it again. So that is the current situation. The CAP is always thinking about what needs to be done in the future, but that is the current situation right now.
Yeah, in India also, the digital slide is not actually considered as for storage. But if you are, Rajiv, what is the situation if it is used for primary diagnosis?
Yeah, so that is the thing which I think you must remember we discussed when we are revising. We are putting the digital in the scope of digital path, in the scope of NABL, and then we have this sort of discussion whether if how much is the retention. So I think we came to the thing, if the glass slide is available, in that case in that case you can even delete the thing. But if it is the only sample, then you have to mandatorily retain it for the period. So, and another problem is the rescanning of the old slide is again a challenge, and you have to do the whole staining again and to get it scanned.
Faded slides.
Yeah, because after 3 to 4 years, maybe after, I can say after 2 years, many times the quality of the slides becomes so poor, and they are not good even for the any AI applications.
Sometimes for reporting also.
Yes, that's
and
true.
because I think because of the environmental conditions also it is happening, or the type of hematoxylin we are using.
Right. There's another question from Dr. Loma. She wants to know any good platforms for digital path and good AI platforms available. So practical questions direct.
So like good platform for digital path depends on like what is the use case that you're looking for. Like, are you looking for education? Are you looking for any kind of like primary sign out cases? Are you looking for consultations? Are you looking for like sharing of data? So it will depend on the use case. There are many open public platforms available for education. Like there's the Leads platform that is available for education, that you can actually go to and start looking at the slides there. Or Rajiv, do you have any resources from Tata?
Yeah,
you are building a data repository,
right? We are building, but it is not yet open for the public use. So once it is all data is collated and completely anonymized, then the plan is to open it for the public use, but it will take the time. And another thing which, as you are aware that we have started the Asian Society of Digital Pathology, and this year, and under umbrella of Asian Society also, we are trying to collate the image data from the various institutes, and this is the initiative coming up so that we can have a common data so that it can help the multi-center collaborative research and even help the various AI developing companies, because they have always this problem. But you also showed the synthetic data. So will that lose all the cancer image biobanks? Will they lose their relevance in future if the synthetic data is coming up in such a
Like
um,
it will never lose relevance because that is the real data. But because it is so difficult to get real data when you're talking about building AI modules, you want data that is more diverse. So
right.
for you it might be easy to get data from Tata, but like, if you want some data from the Middle East, if you want some data from the Southeast Asia, if you want data, it is a very difficult process. And you can, if you really want to build any kind of AI module that works across the world, you need diversity in the data. For that, the synthetic data is going to be pretty good, because then you can say, I need data that is coming from South America, or I need data that is coming from North America or Australia. That way it will be helpful, but it can never replace the original data, because finally, if you're going to do your testing, you'll always have to do it with your original data. Like building can be, you can use a lot of synthetic data, but for the final testing of the AI model, people still would prefer to use real data.
But even for the academic institutes like us, we face a lot of problems when we want to collaborate, especially overseas. There are a lot of paperwork, and government policies are not very streamlined, and we have to really struggle a lot to do all MOUs and other paper formality. And many times the other party, they lose the interest in between, and they feel that these guys are taking too much time for any collaborative work. So actual science lags behind these all clerical, or I can say administrative work. So there is one more question about any legal implication to sign out digital cases for second opinion, especially from outside country.
Like the second opinion is mostly done outside of the country. Like we get cases from India, we get cases from China. So like most of the second opinion consultations are like especially for outside countries. And there is like there are like two things that people have to think about. Like one is, do we need an FDA approved system for doing any kind of pathology? And so that is one misconception that many people have, that you need to have an FDA approved system for. You actually do not need an FDA approved system even for primary diagnosis. Like what most institutions in the US follow or in the world follow, there is a CAP validation study where you have to take 60 cases that you have looked on a glass slide. Then there is a 2-week washout period. And then the same pathologist will look at the same slides on digitally. And if there is 95% concordance and you can document that, then you are good for using the digital pathology for primary diagnosis. So for second opinion, people don't even have to follow this kind of a validation protocol, but most institutions still do it just for the sake of making sure that there is a kind of similar standardization. But for a second opinion consultation, there is no rule that you have to do the CAP validation study or you have to do the FDA approval system. There is no rule right there. You do it without any kind of validation. But most institutions in the US, especially, they definitely do that CAP validation study, even when they're just doing consultation cases. So it is always good to do the validation study with 60 cases. You just take 60 cases that you might have diagnosed on glass even a year before or 6 months before, digitize them, then look at them digitally, because the 2-week washout period has already happened because you made this diagnosis 6 months ago. And then if you can show 95% concordance between what you made a diagnosis on the glass and then the digital, then you are good to go basically.
Yeah.
I think we have addressed all queries or questions which are raised.
Yep.
One maybe thing which is always there in the pathologist or the clinician's mind about the fear to lose the job. But at the same time, do you think there are AI is creating a lot of opportunities for the pathologist at this particular point of time? And
Like,
how can the pathologists grab those opportunities, especially talking about the pathologists who are very keen to work, especially from India, and there are companies maybe from abroad, and so what is your recommendations for them to make use of this opportunity so that they can learn the technology as well as generate the revenue for themselves?
Yeah, so right now, like there's so many, like even in India, like if you look at the startup space in India, or you look at the digital, like there's so much like right now happening in India itself, where multiple different companies are trying to work with pathology data. They're trying to work with radiology data to see what can be done for not like I always stress, like digital pathology is not for pathologists. Like it is like the more importance of digital pathology comes when it starts helping the clinician or the oncologist in helping the patient decide, like, will I develop a metastasis? What is the treatment that is going to be best for me, basically? And with all the data that you already have, let's say you have a lot of data at Tata, like for the example, Tata Cancer Hospital. You have thousands and thousands of patients that you already know the prognosis, what happened to this patient, what treatment was given to this patient, how did the patient fare. So that becomes your training data set, all the previous cases that you already have, basically. So if you were given treatment X, how did the patient do? If you were given treatment Y, how did the patient do? And then those they become training modules, and you use those to now build modules that can like divide the prognosis, treatment, and all of that. That is how the world is now functioning at this point, where they're using all the data from the last 50 years, 20 years that they already have, because they know what treatment was given to this patient, how did the patient do, did the patient survive, did they develop metastasis. So all that now becomes useful information that can be used to train the future models. So a lot of work is actually happening in India at this point, but yes, there's a lot of opportunity around the world.
Thank you very much. And Dr. Gurudutt, anything more from your side, or otherwise we'll
Yeah,
pass the ball to Dr. Pragnesh or Gopal for the final
nothing
comments.
more. It was a very good presentation. Thank you so much, Dr. Raj.
Thank you for the opportunity.
Uh, Thank you, sir. Thank you, Dr. Rajendra, sir. Thank you, Dr. Rajiv, sir, and Dr. Gurudutt, sir, for joining us. It was really an exciting and a session. Obviously, must be very useful for the pathologist and the other physicians who have joined us today. And as you already told, the AI will not replace doctor, but AI will replace the doctors who are not using AI. So everybody needs to be watchful and careful, and we doctors are born to learn. So we keep on learning new things. We were learning science till today, but from now onwards, looking to the thing we have to use. We have to learn technology also. Thank you very much, sir, for a very nice lecture and very nice interaction. Thank you all the faculties for joining, and thank you, Dr. Gopal, for nice coordination. Thank you everyone.
Yes.
Good night.
Thank you.
Thank
Good
you.
night. Good night.
Right.
Thank you.
Good night, sir.
Good night.
Good night.
Thank you,
Okay.
Dr. Gopal.
Yeah.
Thank you.